right, good morning. Buenos dias. Hope everybody's doing great. I'm Floribella Redondo Martinez. I'm the co-founder and the CEO for the Arizona Community Health Workers Association. And today we are presenting our fourth workshop of the series that Asha, along with the Arizona Department of Health Services, Corina Ojeda, we have been planning together. So Corina, do you want to introduce yourself?
Ma'am, good morning, everyone. My name is Karina Ojeda. I am the Health Disparities Program Manager at the Arizona Department of Health Services. I oversee the CHW Voluntary Certification Program at the state. And we are so happy that you guys can join us here on the final of our four-part webinar series.
Thank you, Corina. And when we say that our fourth and our final, it doesn't mean that this is going to be it. We want to make sure that we hear from you. What other topics? Did we have a presentation that you want to see again? Do you have more questions for that presenter? Let us know and we'll bring it back. And we'll also, if you have other ideas of other topics that we can bring together, Corina and I can continue working to strategize and bring those individuals that have the expertise. Like today, we have Alex Zeman and Kelly McGann. They're going to be presenting about Contextor and community cares. And we're really excited because it's such a model that we're really excited to be part of, beginning the process and being part of this information that you're going to be learning. So please let us know if there's anything else that we can bring and we can really offer an opportunity for us to learn more and to really ask the questions that we don't know who to ask and where to ask. So Corina, with that, do you have anything else that you want to add before we begin?
Yeah, I just want to again let everyone know to take this time to really ask questions. And these are the experts, and we have them here for a small part of time. So let's really utilize this time to ask all the questions that you have. And if we need to schedule something follow-up, like Flora said, we can schedule another one.
Awesome. Thank you, Corina. And again, please, and use the chat. Use the chat, Francisco. We have Francisco Oros, who's going to be providing text assistance. So if there's any questions on the chat, he'll bring them to ask them to Alex and Kelly as well. So use the chat for any questions that you want to ask. And I don't know how Alex and Kelly want to do this, if they want to like respond to the questions while they're presenting, or they want to wait until the end. But please use the chat for any questions, any clarification, whatever you guys want to ask. Thank you so much. And with that, Alex and Kelly, thank you so much for agreeing to present today. And thank you for bringing this great information.
Yeah, no, thanks for inviting us. I'm super excited about the conversation today and really want it to be that. Want to answer any questions that folks on the line have. We have we're prepared to do a demonstration if we have additional time to do a demonstration, but really want to make sure that there's a good foundational level of understanding of community cares, kind of what it is, and any questions that folks might have. And maybe some of those can be answered by a demo, but maybe some of them are better suited to just talk through at first. So before we launch, Flora introduced me, but my name is Alex Demian. I'm Vice President of Government Affairs over here at Contextor. I'll give a little bit more about Contextor in a sec, but first I'll turn it over to my colleague, Kelly, to introduce herself really quickly as well.
Hi, good morning, everyone. I'm Kelly McGann. I'm the Director of Social Determinants of Health at Contextor, overseeing the Community Cares program.
Awesome. Thanks, Kelly. So folks may have some familiarity with Contextor, may not. You may have heard of Community Cares, you may have not. You also might have heard of the company we work with, Unite Us. You might have not. I really want to kind of start by level setting on all of those things, more or less, kind of referring to generally the same program. So we are employed by Contextor. That's the company we work for. Contextor itself is Arizona's statewide nonprofit health information exchange, which really means we're kind of the technology that overlays the health system broadly so that patient records can flow between providers, right? So if you're enrolled in Banner for your primary care, but you get sick and have to go to an Honor Health organization for treatment, our health information exchange allows for those patient records to flow between those two health systems, so that once you go back to your primary care doc, you can, be effectively treated, and they have access to those records. That's kind of historically who we are and why we kind of came to be, right? A couple years ago, and Kelly will go into this a little bit, but right before the pandemic, Access launched what's called their Whole Person Care Initiative. And a big cornerstone of the Whole Person Care Initiative was this idea of a closed loop referral system, right? They had decided that treating just physical health, just behavioral health, they were missing a big portion of an individual's health and well-being, that being the social needs that all of us have, right? Access to food, access to housing, shelter, access to adequate income, a livable wage, things like that. So they kind of dove headfirst into providing some funding and resources for addressing some of those social needs. But one thing I was at Access at the time, so I still say we sometimes. But the one thing that kept coming up was, well, okay, we're screening for, we're providers, we're screening for these needs, but when we identify a need, the referral process kind of looks like, hey, do you have a bed? Hey, do you have a food box? And the provider would have to call and spend time trying to find capacity. Or they would just hand a member a pamphlet and say, here's a list of resources. We know you have a housing need. Here's the housing resources in your area, happy hunting, and wouldn't hear back about whether that need was met until they saw the member again, right? So that's what the closed loop referral system tries to solve for. We'll go into that in a moment. I won't take all of Kelly's content, but she'll kind of launch into what the closed loop referral system is, but that's how community cares came to be. So when you hear community cares out in the community, that equals directly Arizona's closed loop referral system. So because we had so much history with health information and exchanging health information, Access approached us as Contexture, and rather they selected us to administer this idea of a closed loop referral system to help solve that need. So we stood up Community Cares. We selected Unite Us as a technology partner to help with the underlying technology of the platform itself. So that's why you'll sometimes hear Community Cares and Unite Us. It is kind of Community Cares is powered by the technology of Unite Us. So we're really excited to actually start bringing in CHWs to the platform and really leveraging it as a referral source. We've been doing a lot of amazing work with Floor and Aschow on, what could this look like for receiving referrals from licensed practitioners, insofar as there's a need to establish medical necessity in order to establish billing for Medicaid. So I think there's a lot of opportunities here for utility of this program as the CHW community begins to kind of take more steps into that healthcare space, because this platform really operates in that gray area between healthcare and social needs, right? Healthcare and community-based organizations. And that's really the purpose it tries to serve, is making those connections where there wasn't a highway, there wasn't a well-established path between those two systems before. So all of that to say, we are at Contexture so excited to be able to oversee and help implement the Community Cares program. We're so excited to start working with the community health worker and community health representative promotore community in a little bit more real way when it comes to this work, because I think there's a significant kind of there's a significant gap when it comes to the delivery system in the members getting from provider to community-based organization, to having that food need met, to having that legal need met. And I think CHWs are really doing a lot of the work already, but really perfectly situated to help fill that gap and ensure that members are able to be interacted with and followed up with in a way that is relevant to them as that referral is sent. Because the referral only means so much, right? It's really the time spent with the member and the people portion of this that's going to make really make the difference at the end of the day. So I guess with all of that as preamble, I'll turn it over to Kelly to give you kind of an overview of what the system is, who we work with, what it looks like and feels like. But really looking forward to whatever questions the group has as well.
Great, thank you. I'm gonna go ahead and share my screen. All right, so I'm going to do a quick overview of the Community Cares program, and then we'll pause for some questions. And if we have time, I'm happy to provide a demonstration as well. So Community Cares really was born out of Access's Whole Person Care Initiative, with the idea of providing tools to identify social risk factors and a solution to connect Arizonans to the needed resources like accessing a food box or housing or employment services. So the goal of the program is really to address the social determinants of health needs of Arizonans across the state. Community Cares is Arizona's statewide closed loop referral system. Oops, sorry about that. Take it back. And it allows for providers, community-based organizations, churches, education institutions, all to connect on one single statewide technology solution. And the goal is to allow all of these providers and organizations to connect across the different sectors utilizing that one technology solution. The platform allows for you to identify the social care needs of the folks that you are working with, and then to send electronic referrals seamlessly across the platform to those community-based organizations and other social care services. And then it allows for you to track outcomes of those referrals. So you will know if you send your client or the person you're working with to a food pantry, you'll receive updates to understand if they were able to access that service.
My name is Kayla Allison, medical assistant. I'll be getting your vitals from it.
Sounds like we have a little bit of feedback. If folks could make sure to mute their lines, that'd be awesome. Thanks.
Thank you. So Community Cares is really a partnership of many providers and organizations, and as well as these providers here or organizations on the screen. And so Access is sponsoring and funding the Community Cares program. Contexture, our role is for oversight and implementation and partnering with you all. And then Unite Us is the technology vendor that powers the Community Cares program. We also partner with Solari and have the full Solari 211 resource directory ingested and available within the platform. The goals of Community Cares are really to support organizations in providing care coordination, connecting communities and providers across the state, with the goal of focusing on improving health outcomes, utilizing a whole person care approach. And then, of course, utilizing the data that we are receiving to really drive the program direction, as well as allowing you all to access data to help inform your community health efforts. As I mentioned earlier, Community Cares connects different providers and communities. Some of the functionality allows for you to utilize screenings and assessments directly within the platform to help identify the social care needs of the folks that you're working with, and then to send those electronic referrals to resources utilizing one technology platform. I mentioned earlier that you'll receive notifications and updates regarding the progress of that referral. And then there's data tracking and analytics as well that's available within the platform. So as of the end of last month, we have had more than 1,000 organizations live utilizing community cares, offering more than 2,600 different programs, all focusing on addressing those social determinants of health or social care needs of Arizonans. So think of, food resources, housing, education, employment services. All of those resources are available to send referrals directly within the platform. We've seen more than 40,000 referrals sent through community cares for more than 30,000 Arizonans. And here are just some of the partners that are utilizing community cares. I know I saw some folks from Unlimited Potential here today. There's many more organizations, but all of their logos wouldn't fit on one slide. So while Community Cares is a free tool for organizations to utilize to send those referrals, we actually also offer some incentives for participating and utilizing a new tool and implementing a new workflow, and to offset some of the staff training time or technology needs as well. So we partner with Access and healthcare providers on their differential adjusted payment program. Providers who participate in community cares and the SDOH DAP program, they receive a increase in their reimbursements from Access for utilizing community cares to identify the social care needs of their patients and then sending referrals across the platform. We also partner with Access within their targeted investment program, which works with healthcare providers for similar milestones, utilizing community cares again to screen for social care needs and then provide that connection to resources. For our community-based organizations, we offer up to $17,000 in program incentives or staff training time to organizations who onboard, complete the training needed to utilize community cares, and then utilize the platform to receive referrals. And then additionally, we offer some milestones specific for our food and housing providers, knowing that those are some of the top requested services within the network. So I mentioned earlier some of the data components that are available within the platform and participating in community cares. And so all participants have the ability to export client level data directly within the platform. So you can really show the impact of the programs and the work that you all are doing. But every participant also has access to an Insights Tableau dashboard that allows for organizations to look at, network activity across the entire state, or you can drive down into looking at a specific community. And then there's also a health equity dashboard, which allows for participants to really understand demographics of the clients that are served across the network. All right, so before we go into a platform demonstration, I'm going to pause here and just see if there's any questions.
8:30.
Feel free to come off of mute or put your questions in the chat.
I'm curious if this is the first time that most people are hearing about community cares, just to kind of get a baseline of if this is something that there's a little bit of familiarity with, if this is the first time. No such thing as dumb questions here. So like, we really want to make sure that, there's an understanding and I don't know, that you feel equipped to even ask the right questions. Maybe that's the first place to start, because this can be, new technology is complicated, right? That's what it would be. But I think it's again, a really unique opportunity as we start to get further into this space and continue to partner with ASCHOW and ADHS in this effort. It's a technology that's free to use for all users, right? So as we're thinking about needing to, as a CHW community, right, needing to implement new technologies in order to bill or to accept referrals and things like that. There's, I think, a really unique opportunity here since Access has, made the strategic decision to invest in this and make it free for all organizations. There's a really unique opportunity to leverage the utility of this platform for some of those needs to hopefully, bring down the other cost factors that might exist as you're thinking about getting further into this space. There's some really cool ideas in the hopper that we have with how the referrals could flow to you all through other organizations such as ASCHOW, etc. So okay, cool. I filibustered a little long enough, I think, to see some questions roll in the chat. So just read about it a few days ago when researching STOH work in Arizona. Awesome. What's the process for getting a CBO on the platform? Kelly, do you want to kind of give the high level of what that would look like?
Yeah, absolutely. So for our community-based organizations, for onboarding, we have we assign a representative from the Contexture team to support the onboarding process. And what that looks like is, we have a community cares agreement for organizations to sign. Once we have that document signed, we then will go ahead and meet with you, provide an overview and demonstration to your organization. From there, we have partner registration sheets, which are really the onboarding documents to understand, how your organization, what services your organization provides, what users you would like to have access to the platform. And then we are able to configure your organization, build it out on the platform. So once we will sit down, we can have a workflow and configuration discussion regarding, how do you currently send referrals and what would be the best way to utilize a tool like Community Cares? Once we have that document completed, we will build out your organization, provide your users access to the platform. And then once that is built, your organization will be able to complete training to understand, how to utilize Community Cares in the Unitas platform. Once you complete training, then your organization will be live.
Yeah, thanks so much, Kelly. And I think the other thing I'll say is we have a team, a statewide team that can come out and meet with you all, and discuss any of these things, sit down and have these conversations around what services you want to provide, what services you don't provide, what types of, what populations you serve, what areas of the state you serve. Like all of those things can be detailed in your profile on the platform, and would be set up through those kind of onboarding and configuration meetings that Kelly mentioned. But that I know can sound kind of daunting, but it's a segmented process, right? So it's just like little chunks at a time to kind of build out the profile. And then the cool thing is we've seen dozens of different workflows on how organizations have used this, right? So you could have everyone in your organization have access to the profile and be entering in member information, and kind of touching those referrals as it goes through, entering the referrals and sending them. You could have one or two people in your organization have access to the platform, and like everyone internally kind of sends up the referral needs to that one person, and they're responsible for typing it in and sending the referrals through the platform. So, there's a high, I would say, level of flexibility in how you all can decide to implement that. And those are, again, conversations where, our team would kind of sit down with your organization individually and say, okay, like, how do you want this to work for you all? Like, it's not a one size fits all. So just wanted to kind of give that high level is, you know, if folks are interested in joining the platform and really can't encourage you all enough to do so. Oh, the other thing is it's free. We have the incentives, right? So there's money on the table for signing up now, but because it's free and because the incentives are there at this point, like what I've been saying is while the dollars are there, it makes sense to sign up, right? Because then at least you can sign up, get the incentive dollars for signing up, and then there's more incentive dollars once you decide you want to utilize the platform, but at least, you know, signing up while those dollars are available makes a lot of sense. And then, you know, if you are like, yes, this sounds great, we'd like to sign up, but we're not really sure exactly how we're going to implement or utilize it, like that's okay too. It's a lot easier for us if you all go from we have a profile, we're configured, but we just don't want to accept referrals right now. You can turn that ability to accept referrals off, so you're not getting kind of inundated with a bunch of referrals. You can turn those off and like take a breath and decide like, okay, now we can open ourselves up for referrals here and there, et cetera, et cetera. And it's a lot easier to turn that lever on and off than it is to, you know, be at a point where you're like, oh, we have capacity, we've decided now we want to enroll. It's going to take a couple weeks to get your platform built out, right, and your profile built out. So would kind of frame it as that as well. Like it's pretty much no risk for signing up. All it would take is the, you know, staff time, which I know is finite, right? Like you don't have all the staff time in the world, but really the only investment that would be made there is taking the time to sit down, look through the agreements, sign the paperwork, and then onboard, and then you can, you know, take as long as you'd like to decide how you want to implement. So okay, looking at the chat, what's the process? We answered that. Does this allow for us to bill with the local health plans? So we have not talked this one through totally yet. Unite Us does have a payments functionality that hasn't been opened for all of the CBOs. We're kind of testing it out with some of the housing work that Access is doing, but currently it's really focused more on that referrals in the door portion of it. So what we've been talking about mostly with Floor and ADHS and the other CHW partners has been that establishment of medical necessity and the referral process in. And then there's kind of that phase 2 of billing, right, where you have to send the claim out in order to get paid, right? So there is a potential for us to utilize some of the technology for that. We haven't talked about that yet, like comprehensively. So I won't say that, like, or I'll say definitively that does not exist current state, but there's a conversation to be had there. What it would allow for is for organizations to receive referrals from licensed practitioners. We have most of the Access registered providers are on the platform at this point because of some of the work that Access has been doing with us on that front. And it does allow for them to attach documents. So if you have a requirement for, you know, a specific document to indicate medical necessity, that could come through with the referral. So it kind of does solve for that front end portion. I recognize fully that there's still the back end and payment portion that has to be worked through, but that's a long answer, a long way to say like it does not yet. I will also say when it comes to the health plans as well, so there's the payment portion of it, but regardless of if we were able to utilize community cares to make some of the payment or to submit some of the claims, organizations would still have to contract with all the health plans, right? So this wouldn't remove that requirement, which is, I think, an important you know, an important piece in all of this. In order to serve, you know, a health plan's membership, you have to have a contract with them specifically. So that's a you know, a little bit of a nuance, but I would say kind of a big one to call out just in the grand scheme of all of this. Are referrals only for those who have access? No, that's a really cool thing about this. So Access made the strategic decision again on a statewide level that this investment was for the good of Arizona. So it can be used by any organization for free, and it can be used to send referrals for any member that you're in. I won't even, any individual, right? They don't have to be a member. So any individual that you're interacting with can be entered into the platform, and a referral can be sent on their behalf if they give consent for you to do so. The caveat there obviously is if you want to bill access, they have to be an access member. But if you want to use the platform for your entire membership, your entire set of individuals that you're serving, whether they're access or not, or they're access today but they're not tomorrow, does not matter for purposes of the platform, and those referrals can still be sent. So that's that one. What else do we have? Mentioned educational organizations as a category of user. What kinds of roles would you imagine health related programs within a university playing within the community cares program? Kelly, I don't know if you have thoughts on this one. I think for me, I would need a little bit more info on like what kind of services the health related program within the university is providing, right? If you're providing like some kind of services or health education services, or like diabetes prevention work, or like general prevention work, things like that, or if you're providing like, it depends on what the health related program is, right? Like if you're providing I don't know, vaccinations, or if you're providing car seats, or if it's a diaper pantry or something like that. I mean, health related programs can take so many shapes and sizes. I guess broadly, right, you could enroll. Well, that's another cool thing. Actually, this brings up a cool thought. So broadly, you can enroll as an organization and then establish different programs under your profile, right? So you could enroll as university, right, department, but then you have like 6 programs that you offer under that department. You can open up each of those individually for referrals so that you don't have to set up 6 different profiles for each of those programs, right? So if you have 2 programs out of 6, that makes sense to receive referrals because you're providing some kind of like service directly to members. You could open up just those 2 and accept referrals for only them. If you are at capacity for one of those 2 at a certain point, you can shut down referrals for that program and just keep the one program open that you still have capacity to serve. So I think there's like, it makes sense if you're doing work directly with members, right? If you're I say members because I come from an access lens in my history. So, but individuals generally, they don't have to be an access member, right? If you're working with individuals, period, and delivering some kind of service, I think it would make sense to onboard, whether or not that's your entire book of business or not. At least it would be another front door for you to receive referrals for individuals that might need that service that you're providing. I'm seeing a few more questions in the chat before. Oh, sorry, Kelly. Yeah, go ahead if you have anything to add on to that first.
Yeah, I think the only thing I would add is, a typical workflow, would for a healthcare organization, right, as you mentioned, could be to receive referrals for those services that you mentioned, but also then for a lot of healthcare orgs and providers, we see a workflow of they utilize the platform to use social determinants of health screeners and assessments directly within the platform and ask those questions around identifying if there's a food need, a housing need, and then really sending referrals out for their patients, their members, to help meet those needs.
Perfect. Yeah. Really, really important point. Okay, so I was saying, I think there's a couple more questions in the chat that we'll address, but I know that was a lot. Like we ran through a few of those questions pretty quickly. So I just want to pause for a second, see if anyone feels the need to come off of mute to ask any clarifying questions, if there's anything we missed. If not, I can keep plugging away at the questions in the chat, but just want to give folks an opportunity to ask any clarifying questions first. Okay. Trying to get comfortable with the silence. It's not my it's not my strong suit, but I think 5 seconds is probably enough for now, and we'll give some more silent time for people to jump in a little bit later. Okay, so another question on how does the exchange of referrals workflow go, basically? Who calls participants? This is a great question. I think maybe Kelly, I'll turn it over to you to give like generally how the workflow and the referral process works, and you know, where in that process individuals will be assigned to the referral. But I also want to kind of eventually chime in with like why I think this conversation is so important with CHWs, because I think there's still kind of a missing link in this that CHWs will be critical in helping to fill.
Yeah, so typically the workflow and pathway for referrals, you know, is that once a need is identified, and if you're working with an organization and you have that a person and have that conversation around, maybe there's a food need, that they would like to be addressed and connected to resources for, you would log into the platform. And you can search for resources based off of the client's address, and it'll tailor resources, you know, within their community. The process also requires, you know, capturing of consent to ensure that, you know, the client is willing to have, you know, their name, their phone number shared with the organization in the platform to receive that referral. So once consent is captured, then that referral will be sent over to the community-based organization or other organization who's providing the service, like a food box. And that organization then can say, okay, we have the capacity to provide this service to this person, accept the referral, and then they will complete the outreach to the client to get them connected to that food box, for example.
Perfect. Yeah, exactly right. And I think what we see sometimes in the platform is, you know, once it's like Kelly mentioned, it's the responsibility of the provider or that originating organization to, like, we'll say screen the member, right? And screening can mean a lot of different things, but essentially identify the need based on a set of questions. It's then their responsibility to send that referral if appropriate. But once it gets out of the hands of that sending organization, it really becomes the responsibility of that receiving organization to take action on that referral. Sometimes there's referrals that go to organizations that are at capacity, that didn't check their profile in a couple days. So it takes a little bit of a long time for those organizations to take action on those referrals, which means there's a member in the middle of this not having their needs met. I think this conversation is so cool and so critical, because in addition to like in addition to the services, like the diabetes prevention work and the other programming that CHWs offer, I think there's a real ability for CHWs to, you know, help walk the member, like not physically walk the member along this process, but like see that there's a referral. Oh, this is a member in my community that has a need, and really like help the member take action on that need, right? So if, as an example, a referral went out to a food pantry and to a CHW organization, right? The CHW organization can say, oh, food need, it looks like a few hours have gone by and that food pantry hasn't taken action on that referral. Let me reach out to the member, make sure they still have that need, then help the member kind of get into contact with that food pantry, or reach out directly to the food pantry to kind of like give them a little nudge to say like, hey, do you have capacity or should we look elsewhere? Because a lot of times that sending organization isn't like taking that next step because they're, I don't know what, right? Like they're at the capacity themselves. They're sending the referral, they're seeing, hundreds of patients maybe a day, and aren't going to get back to that referral until the next day or something like that. And sometimes it's really a timely need, right? Like it's it could be the difference between eating dinner and not, and going to bed hungry. So I really think there's just such an abundance of opportunity to plug this community in somewhere in that. And I don't know where the perfect place to do so is, but I really think it's some version of that. So yes, generally, like Kelly mentioned, that's the referral workflow. And I think there's a ton of opportunity to continue to improve that and plug you all into, that workflow at different places to make sure members are getting their needs met. Okay. Are there any use case examples or models available that show the different ways current CBOs are using the platform? Looking to get some preliminary ideas of how we could best use the platform. We do have some existing workflows that we can send through Floor. What I will caveat that with is, one organization, right? So they're good points of reference and maybe to start some brainstorming, but it's not, you don't have to absorb those examples as like these are the only options, right? That's the value of kind of how the onboarding process is set up, is we can take that time to sit down and talk through like, oh, we saw this workflow, but we're curious if we can do X or Y or Z. And we can say, yes, that's possible, or no, there's this limitation. So we might want to, look at doing it this way. So we can get that as kind of a follow-up item to the group for some examples. And would, if you would like to talk to some of these existing organizations, we can help facilitate some of those conversations to see, how they've had successes in using it. I really think that the organizations that we've seen have a tremendous amount of success have really bought in and thought through, like, how do we change our processes, in a way that's going to leverage community cares as like an additive benefit, as opposed to to just another system or just another box to check, because that's not where the value is, like, right? That's not what we want the platform to be at all. So the ones that have been successful have taken that time to really sit down and think through, okay, before we try to roll this out, like, what is the best way for our staff to use it? Is it going to reduce their their workload at the end of the day and be of value? So want to make that kind of a standing offer that, in addition to whatever we send, we're happy to sit down and talk through individually some of this stuff. Okay. Are there eligibility requirements per referral service built into the system? So this is a really good question. There's no eligibility requirements for the member to be entered into the system, right? So remember that any individual that you're interacting with can be loaded into the system, and a referral can be sent on their behalf if they give you consent to send it. Where the eligibility requirements do exist is on the program that you're referring to, right? So if there's a program that only serves veterans, if you send a referral to them, it's going to bounce back and say, no, if you look at our profile, it says we can only serve veterans. Another one we'll see sometimes is programs for like not state governments, local governments. So like we can only serve individuals in Mesa, right? So if you send a referral for an individual whose address is outside of Mesa, it'll bounce back from them and say, we can only serve members in this area of the state. Or this area of the city. So all of that is listed in the CBO's profile. There's no hard stop though, is the thing, right? So it's important, you know, when you're sending the referral to just click into that profile before you send the referral out and make sure that there's no specific eligibility requirements. I would say the majority of organizations don't have like super specific requirements like that. They have limits on the types of services that they provide because they're, you know, they exist to provide a certain kind of service, right? So they're not going to provide all of the things, but most of them, I would say, are able to, you know, to receive referrals. The only way you would automatically get notified of that referral not being accepted is if they reject it, right? And that's usually what would come through is, you know, we're rejecting your referral because we can only serve these kinds of members. But there's no hard stop in the system to say, nope, stop, don't send this referral because it looks like this member doesn't meet the eligibility requirements. We're working towards that eventually, like that's an ideal future state, but there's just so many member needs are so complex. Individual organizations, like requirements for serving can be so complex that it's hard to build in a filter that's thorough enough to not filter out like good referrals essentially. So we'd rather those go through and the organization reject them as opposed to arbitrarily, you know, screening some of those out when they could actually meet the needs. So really that onus is put on the accepting organization to decide whether or not they're able to serve that member. Hopefully that answers your question, but like generally anyone can be put into the system and a referral can be sent, but organizations have some specific requirements. And I'm sure you all are familiar with that, right? Some orgs are grant-based and grant funded, so they have, you know, the services have to be really specific to a diagnosis or something like that, or an area of the state or whatever the case might be. So, yeah, anyways. Okay. Kelly, anything you feel like I missed or mischaracterized in any of that?
No, I guess the only thing I would add is, you know, all that information about program services eligibility, you know, that is all part of the onboarding process as well. But then organizations have the ability to update in real time, you know, their program information directly in the platform, as well as the ability to, you know, turn off if they, for, you know, we're at capacity. For example, you have the ability to just log into the platform and turn off the functionality to receive referrals.
All right. I think that brings us up to the current chat comments. So I don't know that we have enough time to do a demo right now, and we can always come back for and do a full demo. So there's another couple of options. We run regular information sessions that we can send you the info on if you would like to just jump into a general information session. Those are really good at giving a high level demonstration of what the platform looks and feels like and how you can utilize it. Usually there's a low enough group, a number of people that you can really ask your specific questions. But sometimes you might get a bunch of questions and or a bunch of people attend and only get one or two in. So if you have additional questions after that, or if you'd rather just have a one-on-one meeting directly, Kelly put the email box in the chat. Floor knows how to get in touch with us. She knows where our emails are. So always feel free to reach out to us as resources as well. And we can set something up specifically if you'd prefer to just meet one-to-one and ask your questions that you have. So we can do a demo in that context as well. So I'll defer to you if it would be valuable for us to come back and do that, or if we want to handle that elsewhere, totally up to you. We're happy to help either way. So I think unless Flor, do you have any questions or you have anything that you feel like we
No.
missed or you'd want us to clarify further?
No, I think
That's
that was
probably
great.
about it from us. Yeah.
Yeah, that was great information, Alex and Kelly. I think that it was really well informed. But one of the things that I do want to say is that Asha is going through the process, and just meeting one-on-one, it's a game changer. So I would encourage that if you're interested, please reach out, and they will work with you, and they will provide information and a specific individual staff member will be in contact with you, providing you all the details and meeting with you, answering questions. So I think that is really great to have this opportunity. And I just encourage anybody that is interested to please reach out, and if you guys would like, and I think to me, Alex, of course, always bring and record that the what you were not able to do today, that role, the role of how do you do it, and specifically, and show a demo. I think that's always great. So if everybody would love, I think that at least I would love to do that and just get it recorded so we can uplift it also into our website and offer it for anybody that has any other questions. Always can come back and see it again and see it again and see it again. But at the same time, please reach out to Alex and also Kelly to make sure that you guys ask any questions that were not like answered today, and you were not able to ask the question, or you didn't know what to ask until you go back to your organization and say, oh, I should have asked this. So always there's time. Please let us know. We will continue to bring this type of informational webinars, workshops, so you can continue learning about the opportunities that we have in our state, but also the great programs and resources that are available for us, for community-based organizations and for CHW organizations as well. So I just want to say, Alex and Kelly, thank you so much for making the time. And we were probably, Corina, do you agree that would be great if we can come back and with Alex and Kelly, maybe do that demo and record it for everybody?
Yeah, most definitely. I think that'd be an awesome idea. And like Flor said, please feel free to reach out to us if you have any additional questions or you want to schedule that one-on-one. And if there's other topics that you guys want to go over as well too, we can definitely hold this safe space for you all to bring in presenters, bring in organizations if you need that extra support, extra TA. We are more than happy to set that up for you all, because it's more than likely if you have that question, someone else does as well too.
Definitely. Thank you, Corina. And again, Alex, Kelly, thank you. And thank you, everyone. Thank you, Francisco. Thank you, Liz, for providing this service today to our members. And I'm just really grateful that everybody took the time to be here. And this is not the end. If you still have other questions, please reach out. You can always reach out to me, to Corina. We can reach out to Alex and Kelly, or you can reach directly to them. So thank you so much. I hope you have a wonderful day today.
Thank you. Take
Thanks
care.
all. You too. Bye.